mynews.studio.
Picture a dusty village in West Africa. A child's cry cuts through the quiet. This time, not from the pain of meningitis, but from a quick, almost painless vaccine. Is it possible that science is finally moving faster than epidemic diseases?
Today is November 14th, 2025. Let's start with the basics. There's a new 5-in-1 meningitis vaccine rolling out across Africa's so-called meningitis belt. That's the stretch from Senegal to Ethiopia, an area that's faced deadly outbreaks for decades. What's actually new about this vaccine?
This vaccine covers 5 major strains of the bacteria that cause meningitis. Earlier vaccines usually protected against just 1 or 2. By combining them, we interrupt several transmission chains at once. It's a significant shift in epidemic control.
Have we seen any results yet? I mean, on the ground.
The early data looks good. In the pilot areas, cases have dropped sharply in just a few months. But the key is reaching everyone. Community health workers, local leaders, they're crucial for convincing people to get vaccinated, especially where there's skepticism.
That keeps coming up. Actually, in Bangladesh, local health workers were essential to eliminating kala-azar. Bangladesh is now the first country to officially eliminate visceral leishmaniasis, a disease that used to kill thousands every year. How did they do it?
They used several strategies, going door to door, using rapid diagnostics, and offering prompt treatment. But the real backbone was local health workers, traveling to remote villages, checking on everyone, following up with patients. Partnerships with global health organizations also brought in funding and logistics support.
So, could other countries use these same approaches for things like tuberculosis or polio?
Definitely. The pattern is clear. Combine new science, better vaccines or treatments, with strong surveillance and real community engagement. For TB and polio, that means scaling up rapid tests, making treatments accessible, and investing in constant monitoring.
Let's talk about funding. These programs rely a lot on donors, governments, and foundations. But after the headlines fade, how do countries keep up disease surveillance and prevention?
That's the tough part. In Bangladesh, for example, they built kala-azar control into their national health budget. Long-term, countries need multi-year commitments from donors and also partnerships with the private sector. Building resilient health systems so outbreaks can be caught and stopped fast takes more than just disease-specific money.
Belize was just certified malaria-free by the World Health Organization. Another example of sticking with it. But what if the funding dries up? Could these diseases come back?
History says yes. When surveillance weakens, diseases often resurge. Long-term success depends on more than money. It takes political will and constant training for health workers. Incentivizing local staff and linking disease surveillance to other health services makes elimination more sustainable.
Let's go back to community engagement. In Nigeria's meningitis campaign, local leaders played a big role, right? What should we take from that?
Local leaders know their communities. They can address fears and push back against misinformation. Training and supporting them, along with health workers, turns them into real partners, not just messengers. That's been key for both vaccine acceptance and tracking diseases.
So, there's a clear pattern. Scientific progress matters, but it's really the people on the ground, health workers, leaders, families, who make or break these efforts.
Exactly. And now, with more people worldwide getting clean water and electricity, and child mortality at its lowest ever, we're seeing broader improvements that help with disease control. It shows how health interventions are connected with bigger changes.
Looking at TB, polio, and other infectious diseases, are we close to seeing more countries eliminate them?
We have the roadmap. Invest in vaccines and treatments, strengthen local health systems, involve communities, and secure steady funding. The real question is, will governments and donors keep supporting these efforts?
That's the big unknown. But today's stories from Africa, Bangladesh, and Belize show what's possible when science and communities work together.
Today we covered new vaccines in Africa, disease elimination in Bangladesh and Belize, and why local health workers and funding matter. The fight isn't finished, but we have better tools than ever.
Thanks for listening. This episode was brought to you by mynews.studio. You can try it for free.